March is Colorectal Cancer Awareness Month, and it comes at a time when studies show more young people are developing the disease. That has many doctors and health advocates sounding the alarm, and I'm glad many of you are paying attention. We've been doing a lot of these segments now on colon and other cancers. Joining me today is Dr. Lynn O'Connor, Chief of Colon and Rectal Surgery at both Mercy and St. Joseph's Hospitals. Thank you so much for being here.
Thank you very much.
You know, I started saying that people are paying attention. I got a message last night from somebody who said, you know, you've been doing a lot on cancer, and I finally decided to go and get myself checked. So
wonderful.
This is Colorectal Awareness Month. Tell us what it is.
It's really important for people to be screened throughout the entire year.
Yeah.
However, March is the month that we actually highlight Colorectal Awareness Month, where we let people know the importance of screening, of healthy eating, and all the ways to help prevent colorectal cancer.
Tell me what the colon does, because everybody at this point, I think, know I had pancreatic cancer. And when I was given the news, I was like, do I need that? What does it do? So I always ask, you know, what does this organ do?
It's a 5 to 6 foot organ in our body, and it helps with the absorption of nutrients, electrolytes, and water for partially digested food, and the remaining of it is waste. So it's a system that helps move the waste throughout our body.
How does a tumor develop there?
Tumors are really just normal colon cells that keep growing and develop into a polyp. And then that polyp keeps growing and eventually turns into a cancer, which is why when you do a screening colonoscopy, you're able to prevent the colon cancer if you can get those polyps before they turn.
Who are the folks who are most at risk for this?
It's really interesting. Traditionally, colorectal cancer was an older disease where you had people 50, 60, 70 years of age or older getting it. Unfortunately, now we're finding an alarming rate of younger patients with early onset colorectal cancer. So but that's something that we need to do more research on, and that we're finding in our hospitals, in my office, and what I do.
Tell us about screening and what it entails, because oftentimes, you know, people are afraid to go to the doctor because they don't know what to expect.
Exactly. I always tell my patients the best screening test is the one that's done. So there are several screening kits. We all know about Cologuard, Get Go Gone, and you do it at home. But I do screening colonoscopies, and I do them in my office and at my outpatient centers. The screening colonoscopies are the only modality in which is both diagnostic, so we can go around, we find a polyp, and we remove it, which is therapeutic. So if we can find a polyp early, you prevent the cancer. And if you're screened on time, we can find a cancer that's early, and then there's a greater chance of cure.
What happens if somebody goes to the doctor and they do discover that they have cancer? What's the next step?
The next step, if you do have cancer, is a full workup to make sure that it's confined just to the colon. Because we find it early and it's confined to the colon, that's a 95% survival rate. But what patients have to do after that, if it's a colon cancer, they'll get a blood workup, a CEA level, they'll get a CT scan of the chest, abdomen, pelvis to make sure it hasn't spread. And for folks who have rectal disease, we usually have them have an MRI in addition to that.
All right, and the CEA level is what tells you what level?
Basically, it's called carcinoembryonic antigen, and it's just a baseline level so that if a patient has it elevated, it may mean it's more advanced disease, and we follow that level after surgery to see whether or not it's gone down.
Yeah. All right, I know all about that. Can you tell me some of the symptoms? If people are experiencing some of these symptoms, what they should do?
Well, we try to at least get people before they experience symptoms. But if they are experiencing symptoms such as rectal bleeding, such as weight loss, such as abdominal pain, change in bowel habits, that's when you should speak with your doctor and arrange a screening colonoscopy for you.
Sudden weight loss seems to be a good indicator that something is wrong in your body.
Yes. I have patients who come to my office and they'll say, Dr. O'Connor, I have unintentional 20 to 30 pound weight loss over a short period of time.
Yeah.
That's an alarm. And that's something that needs to be paid attention to.
I only have a minute left, but I'm really curious about you. How'd you get to where you are?
I absolutely love operating on patients, and I love the fact that this is a disease and this is an area where you can do preventative treatment. You can, it's empowering, it's educational, and you're really able to affect change and save lives.
Where are you from?
I am from born in Manhattan, raised in Queens.
Oh, you're a Queens girl too.
I'm a Queens girl.
We have a lot of Queens folks in our audience. And where did you go to school?
I went to Bronx Science for high school. I went to Rutgers for undergrad, Yale for my master's degree, Temple for my medical degree.
Wow, so you were smart your whole life. Is that what you're saying? Okay, I hope you inspired some of the young people who are watching as well. Dr. O'Connor, it's great to have you with us on today. Before I let you go, can you just tell folks to go get screened? It's so hard.
They have to. It's so important. And unfortunately, a third of Americans who are eligible to get screened don't. And I want people to know that the screening age is now 45.
Okay.
Because of the early onset colorectal cancer we're finding. They lowered it. So get screened. And if you have someone who has symptoms, make sure you take them to get screened. And when you get screened, go bring somebody with you to get screened.
Make it a family affair, folks.
Exactly.
All right, we'll be right back.